Are you over 60 and find yourself coughing up mucus almost every day, even though you haven't had a cold? You might think it's just part of getting older, but what if I told you it's 6 silent habits that are making you struggle? Every cough, every sticky throat, every morning you wake up with phlegm is a signal that your lungs and airways are working harder than they should. The good news? These habits are fixable, naturally, gently, and you can start today. If you keep ignoring this, your breathing gets harder, your energy drops, but if you act, you can breathe easier again. In this video, I'll share 6 habits you can adopt to stop coughing up mucus every day, especially designed for seniors over 60. Each one is backed by real research in aging lungs, mucus clearance, and respiratory health. Stay with me until the end, because habit number 1 is the one that often gets overlooked yet makes the biggest difference. 6. Habit: hydrate consistently and lightly warm your airways. As you age, one of the biggest changes in the respiratory system is dryness. The delicate lining of your airways loses its ability to hold moisture. A 2024 review titled "The Aging Lung" shows that aging lungs lose their moisture holding and clearance ability. Think of mucus like honey. When it's dry, it becomes thick and sticky, clinging to your airways and making it incredibly difficult to cough up. How to apply it? The key here is smart hydration. Instead of chugging large glasses of cold water, focus on taking small sips of warm water or herbal warm tea every hour. The warmth acts as a natural expectorant, helping to thin the mucus and make it more mobile. Avoid very cold drinks, which can cause a minor spasm in the airways. Additionally, try breathing in steam for a few minutes each day. You don't need a special device. The steam from a hot shower or a bowl of hot water will do. The result is loosened mucus and much easier clearance. This next habit will boost your immune support. 5. Habit: gentle aerobic movement every day. Older lungs move less air and ciliary clearance is reduced. Imagine your airways are lined with millions of tiny little brooms called cilia, whose job is to sweep mucus and debris up and out of the lungs. As we age, these brooms slow down. A 2024 study on airway mucus in older people found meaningful mucus plugs even in older adults without a chronic illness. Gentle movement is how you get those brooms working again. It helps you breathe more deeply, getting air behind the mucus plugs and creating gentle vibrations that help to loosen them. How to apply it? Gentle daily aerobic movement is a must. Take a 15-minute walk after your warm drink, or do arm swings, gentle torso twists, and slow stair climbs. You're not just going for a walk, you are actively participating in your body's natural lung cleaning process. Coming up, habit number 4, a simple change for your sleep. 4. Habit: sleep with your head elevated and open your nasal passages. Do you find your mucus is worse in the morning? The culprit is often a buildup of mucus at night from poor drainage and postnasal drip. When you lie flat, gravity causes mucus from your sinuses to drain down the back of your throat and pool there. A 2025 review on rhinitis in older adults found that impaired nasal clearance contributes to persistent mucus and a reduced quality of life. How to apply it? Sleep with your head elevated by about 6 to 8 inches, 15 to 20 centimeters. You can use an extra pillow or a dedicated wedge pillow. This lets gravity work in your favor, encouraging mucus to drain properly. Additionally, use a saline nasal rinse before bed. Think of it like flushing your nose. It clears out allergens, dust, and moistens the nasal passages, preventing overnight buildup. A humidifier in the bedroom can also be very helpful. The next habit is about what you eat. 3. Habit: reduce dairy, processed foods, and boost anti-inflammatory foods. Mucus production is often worsened by chronic low-grade inflammation and diet. The Aging Lung Review shows that there is increased inflammation in older airways, making them more reactive to triggers. Certain foods, particularly heavy dairy, fried foods, and sugar, can promote this inflammation and trigger the body to produce more mucus. How to apply it? This isn't about a restrictive diet. Simply cut back on heavy dairy, fried foods, and sugar and see how your body responds. At the same time, boost your intake of anti-inflammatory foods. Add warm soups, ginger, garlic, and leafy greens to your diet. Ginger and garlic are powerful natural anti-inflammatories that can help soothe your airways. 2. Habit: deep breathing exercises and controlled cough technique. Because lungs age, the tools to clear mucus, like the cough reflex and ciliary motion, weaken. The mucus plug research shows this clearly. A harsh, uncontrolled cough is not only exhausting, but can also irritate your throat, leading to a vicious cycle of coughing and inflammation. A controlled cough technique, also known as huffing, is far more effective and gentler. How to apply it? Practice this twice a day, preferably after movement. Sit upright, feet flat on the floor. Inhale fully and slowly through your nose for 3 seconds. Hold your breath for 1 second. Exhale slowly through your mouth for 5 seconds. Repeat 5 times. After the last exhale, perform a gentle, controlled cough from your diaphragm, like you're trying to fog up a mirror to clear your throat. And finally, habit number 1. 1. Habit, daily lungs check and address underlying triggers. This is the most overlooked but most important habit. Persistent mucus is often not the root problem, it is a symptom. If you only treat the symptom without finding the cause, it will never fully go away. Common triggers include allergies to dust mites, pollen, GERD, acid reflux, silent sinus issues, or the effects of past smoking. The study on rhinitis in the elderly found that 3 to 12% have overlooked nasal inflammation. How to apply it? Become a detective for your own health. Every day, ask yourself, did I cough mucus today? How often? If the answer is yes, it's time to act. See your doctor. Ask about postnasal drip, get your sinuses checked, and discuss the possibility of allergies or acid reflux. Fix the trigger and the mucus drops. This is the habit that truly stops the cycle. So now you know 6 natural habits that help seniors over 60 stop coughing up mucus every day. These are not pills or expensive treatments, just simple research-based actions you can begin this week. Start today. Warm water, gentle movement, an elevated sleep position, an anti-inflammatory diet, breathing exercises, and check for the trigger. Your airways will feel clearer, your days will be easier, and your breathing will be stronger. If this video helped you, please give it a like, share it with someone who's been coughing up mucus, and subscribe so you don't miss the next senior secrets for a healthier, older you. If you're over 60, listen carefully. Nearly half of fatal heart attacks happen at home before the person ever reaches a doctor. Not because the attack is too severe, but because they didn't know the 7 simple steps that can keep them alive for just a few more minutes. In this video, I'll show you exactly what to do, and trust me, step number 3 could save you or someone you love. My name is Dr. James, an emergency physician with over 30 years of experience, and every day I see people who could have survived if only they knew what to do in the first 5 minutes. If you're over 60, live alone, or have parents in their senior years, this video is extremely important. Today, I'll walk you through 7 life-saving actions backed by science that dramatically increase your chances of surviving a heart attack when you're completely alone. Let's begin. Number 7. Call emergency services immediately. The first and most important step is simple. Call emergency services right away. Don't wait. Don't see if the pain goes away. Don't assume it's indigestion or stress. Symptoms like chest pressure, sudden shortness of breath, nausea, dizziness, cold sweating, or pain radiating to the jaw or arm are red flags. Studies show that people who call within 5 to 10 minutes have up to 50% higher survival rates. A short delay can be the difference between life and death. If you suspect even 1% that it's a heart attack, act 100%. Number 6. Chew an aspirin if you're not allergic. Right after calling emergency services, do something that can literally keep your blood flowing. Chew, don't swallow whole, 1 325 milligram aspirin. Aspirin doesn't stop the attack, but it prevents the blood clot from getting bigger. Chewing allows the medication to enter your bloodstream much faster than swallowing it whole, which is crucial because your heart is starving for oxygen. Skip this step if you're allergic to aspirin, you have bleeding disorders, a doctor has told you not to take it. Otherwise, this step is absolutely vital. Number 5. Loosen tight clothing and sit upright. Your body position affects how much oxygen your lungs can take in. Do not lie down. Do not hunch forward. Instead, sit upright with your back supported by a chair or wall. Loosen anything that restricts your breathing, such as belts, waistbands, tight shirts, anything around your neck. This reduces pressure on your lungs and makes breathing easier. Many of my elderly patients reported immediate relief just by changing position properly. 4. Cough forcefully if you feel faint. Cough CPR. If you start feeling lightheaded, dizzy, like you're about to pass out, use the forced cough technique. Here's how. Take a deep breath. Cough strongly, as if trying to clear something stuck in your chest. Repeat every 2 to 3 seconds. The pressure created inside your chest helps push blood to your brain. This can keep you conscious long enough for help to arrive. I've personally seen patients survive because they use this technique in the critical moment. Number 3. Unlock the door and keep your phone close. You've called for help, but emergency responders can't save you if they can't get inside. Many tragic deaths happen simply because the patient collapsed before unlocking the door. So, if you're able to move, unlock your front door or open it slightly. Keep your phone on speaker mode right beside you. Every minute lost outside the door is a minute your heart may not have. This one action could determine whether help reaches you in time. Number 2. Breathe slowly and deliberately. Fear makes you breathe fast, which forces your heart to work even harder, the exact opposite of what you need. Instead, use controlled breathing. Inhale through your nose for 4 seconds. Hold for 1 second. Exhale slowly for 6 seconds. Repeat. Deep breathing calms your nervous system, lowers your heart rate, and helps you stay conscious. One thing I always tell my senior patients is, you can't control the heart attack, but you can control your breathing. Number 1. Stay still. Don't walk or drive. During a heart attack, the heart is desperate for oxygen. Any movement, even walking across the room, increases oxygen demand and makes the attack worse. Do not walk around, go look for medication, try to drive yourself, change rooms, attempt to push through it. Sit still. Let your body conserve every bit of energy to keep your heart functioning. The less you move, the better your chances. If you're over 60, these 7 steps could save your life or the life of someone you dearly love. A heart attack doesn't warn you, it doesn't wait for a better moment, but you can be prepared. Just remember, call early, stay calm, breathe slowly, and don't move unless absolutely necessary. Starting today, keep aspirin at home, review these steps once a month, and share them with your family. And if this video has helped you feel safer and more confident, please like, share, and subscribe. More life-saving tips for your best years are on the way.